All right, we're back again. So now that we've demonstrated some of the basic components of a physical health assessment with my handy partner, who's so graciously volunteered, I've sent him away, and I am going to do a really quick assessment on the basics of a breast exam as well as a basic testes exam. I'm going to be demonstrating the breast exam on myself and using a handmade prop. You'll have to use your imagination, and this size is just increased for clarity of a basic testes exam. Now, as we mentioned, a breast exam is something that you want to educate your patient on and doing regularly, especially as they enter that late adolescent stage all the way up until late adulthood. Women should ideally do this exam once a month, and it's not uncommon for many women to kind of time the occurrence of their self-breast exam with the start or stop of their menses or periods. And it should also be important to note that we regularly advocate for both men and women to do these breast exams because, as we know, cancer is not sexually discriminatory and men can get breast cancer in this region. So I'm going to do a basic demonstration. I hope that you can see it kind of clearly. Typically, you want to start, be sure to include and start kind of in the armpit section of your body, and you want to do a medium to firm palpitation going in a wave-like pattern down and back up, gently palpating. The goal of this is to kind of discern and feel those tissues and muscles and weed out any abnormal lumps, hardness, misshapen or sensitive spots of your body. It's important to note that, especially in women, you're often going to feel those kind of irregularly shaped, softer adipose and muscle tissues. That is really not uncommon just because of the physical makeup of the breast. But what you're really looking for is something kind of stone-like. You want to also be sure to gently palpate around the areola or nipple region, making sure to kind of feel in and on top of the nipple as well to see if there's any unusual lumps. Once that's done, you'll obviously move to the other side, repeating the process. If you were to do this process on a patient, most likely the patient would be laying down, though, with some sort of support like a pillow underneath their back for comfort. Though you can educate your patients that standing up in the shower is fine, in front of a mirror to use as a sort of guidance, as well as maybe laying down in bed. And again, it's just really important that we are clear that this is something that we want to do pretty regularly from the start of late adolescence into later life for both men and women. Now, the male testes is kind of the same thought process. You do use kind of the same like wave-like palpitation pattern, but it is really important during the assessment process to just be a little gentler and your palpitation strength, as obviously the testes are a bit more sensitive. So again, you're gently palpating each of the testes, both front and back, and a wave pattern. We'll have to use our imagination just a little bit because the shape of my homemade prop is not exactly right. But you're really discerning and looking for almost marble or stone-like masses that isn't supposed to be in the testes, frankly. And you can educate your patient to do this again starting in the late adolescence. It's best done monthly, though it doesn't necessarily have to be done at the same time every single month. And then as your male patient enters his later years of life, it is also important to advocate for regular routine exams, including that of his prostate. And that is all. Thank you.